In the midst of all the war going on in Iran and all of the ICE raids that are happening all across the country, and that is what everybody's paying attention to, Mike Johnson, Speaker of the House, is steadily working on getting that big bullshit bill passed through that's going to cut Medicaid for probably about 10 million poor Americans. Not to mention the food stamps, cuts to SNAP benefits and eventually cuts to Medicaid itself. But anyway, I digress. But here is old Mike Johnson. He's giving a little speech on Right Side Broadcasting Network. You think that's patriotic enough? We got a flag here. Got to have a flag on it, man. Everything is the red, white, and the blue. Can't forget that. But here's Mike Johnson. And he is yet again going out scolding the shit out of people to shame them for having health care. And I would like to remind you that people, the poor people that are on Medicaid, they're divided up into a few groups. 65% of them actually have jobs. They're just earning less than, like, they're earning like 15, 16, 17 grand a year, which, by the way, I do not know how you can live on that little amount of money. Considering, I think the cheapest rent in America for a small studio apartment is like around $800 a month. And if you're making 16 grand a year, that's half your paycheck in rent. And that's if you're living in that place that has the cheap rent. That's the lowest rent. Anyway, so 65% are working. There is a contingent that are on long-term care that are they can't work. Their legs or their health in some respect, they're not able to work. There is a small contingent that is also caring for like an elderly parent or a sick family member, and they can't work, or they don't have enough time because they're busy at home taking care of that person. So they can't work. And I think the total, and by the way, keep this in mind. Medicare, what you get when you retire, Medicare does not cover long-term health care. Medicaid covers long-term health care. So if you are somebody who is, terminally ill, I shouldn't say, just say critically ill, and you cannot work, you cannot physically go out and do anything, you are on some sort of long-term care, and we should give you health care. Because honestly, here's the thing, folks. If you are sick and you do not have any health care, you ignore it. You ignore it. You ignore it until it bites you in the ass, and then you have to go to the emergency room, and then that emergency room has to take you in. And then we, the American taxpayers, have to pay for it. It also puts strain on small hospitals that don't have the room, don't have the beds to have to handle it. It costs that small community money because we have to now take care of somebody who had no health care and couldn't afford the health care and now is in the middle of an emergency, and we have to throw money at it. So your tax dollars are going to fund it anyway, either way. So maybe tax dollars to fund preventative health as opposed to let's just handle it as you're dying, Anyway, here's Mike Johnson scolding the folks. Oh, Jesus Christ, it's so pathetic.
You've got a number of provisions. We want to make sure that we hold by our commitment that we are not cutting Medicaid. The President has said that, and I've said that. We've all said that. We are strengthening the program for the people who are the most vulnerable population.
We're strengthening it by cutting it. We're not cutting it, we're reforming it. You just got to keep those little key words in mind. It's like, when somebody like Bernie Sanders says that healthcare is a human right, and then a centrist Dem goes, yeah, I agree with that. I think that everybody should have access to healthcare. Like, honey, I live in New York City. If I go over to 11th Avenue at the Lamborghini store, I have access to the fucking Lamborghini. Doesn't mean I can fucking afford it. But whatever.
Who really rely upon that. You're talking about the disabled the elderly, young pregnant women, for example. Those resources won't be available for those people who desperately need it and deserve it if young, able-bodied men, for example, are...
Yes, they can. They can have access to it because we could fund it. I mean, how much did we spend on Donald Trump's bullshit parade? Like $50 million? How many people's health care could have been covered with that? You know, about the 50 bombs that we just dropped on Iran. How many people's health care just blew up a fucking mountain?
Are on the program and not working. So we introduced a work requirement on the House side. It's wildly popular with the people because it follows common sense. If you're going to be on the public wagon and you're able, you should try to help pull it. And all we did was put in there, as you all know, a 20-hour work requirement per...
That's all we did, man, a 20-hour work requirement. I mean, maybe you can't walk, you know, maybe you can't use your arms or something, but, 20 hours. I mean, what's the big deal? I already said that 65% of people who are on Medicaid actually have jobs that work. I mean, never mind the fact that if you have a job that work, like let's say you work at Walmart, the very first thing they give you as soon as you get hired by Walmart is they give you a form to fill out to apply for Medicaid. And here's another form to apply for food stamps because we're not going to pay you a living wage. And God forbid we could give you anything over 30 hours a week because then you'd be full time. And then we'd be responsible for paying some of these social services. So these people are already working jobs. But yet, here he is going, I'm just saying 20 hours a week. I mean, my God, it's such a hardship. You guys act like I'm asking you so much. There's all of these able-bodied men languishing away in their mom's basement, eating Cheetos and playing video games. If you're going to be on the company wagon, you should be able to get off the wagon and push a little bit too. Come on. Stop being so selfish. There are a lot of rich people that need tax cuts, goddammit. And if it means that you're going to have to get your crippled ass off the wagon and push it a little bit, then that's what you're going to have to do, goddammit.
20 hours. You guys work 80 hours, I'm sure, right? Give me a break. And they're complaining about that. You either have to be working, you have to be looking for a job in a job training program, or volunteering in your community. For heaven's sakes, do something constructive. That is something that everybody nods their head in agreement at a town hall and says, yes, do that. Why didn't we do it already, right?
Oh, Jesus Christ, man. These guys who work about 6 months out of the year, they want to get this bill passed by July 4th so they can go on their long summer break, and you will not see them again until after Labor Day. They're done. They get a whole summer break off like they were, teachers or, they're, high school students, and they get a whole summer break. Not to mention all the other times that they go on break. These are some of the laziest mofos you've ever seen. All they do is walk around the halls of Congress and then make phone calls for the rest of the day trying to get donors to give them big cash. But yet, you need to get off your lazy ass and work. Anyway, you've got an article in Politico. Uniquely vulnerable. Louisiana girds for mega bill fallout. Mike Johnson is a congressman from the great state of Louisiana, and as if there was nothing to fix in Louisiana, the 9th Ward is still just a hellhole, and Katrina happened in 2005. Could there be anything else he could be doing for his constituents? No. Louisiana, MAGA support runs deep here in the House Speaker Mike Johnson's home turf. But Louisiana officials from both parties are increasingly worried about the consequences for their constituents of Johnson-led mega bill that's being fiercely debated on Capitol Hill. I don't know how fiercely it's being debated, how bad it should be. Should we cut 10 million people off of Medicaid, or should we cut 15 million off of Medicaid? That still involving proposal would overhaul health care and food assistance programs to pay for tax cuts and other aspects of President Donald Trump's agenda. Louisiana is poorer, sicker, and hungrier than most states. Ain't that the truth? And look at this smiling fucking Yahoo right here. Yeah, man, your state got one of the lowest literacy rates, the highest poverty rates. But yeah, man, you're a good guy. Look how great your hair is combed. And look how big the flag is on your lapel. And the deep cuts to Medicaid have a growing number of Republicans in Louisiana worried that Congress and the White House are going too far. They are anxious that rural hospitals whose finances are highly dependent on federal Medicaid funds would face crippling revenue losses and be forced to shut down. Yeah, that's right. A lot of rural hospitals rely on Medicaid because the people that come into those hospitals have Medicaid. So those are dollars that are no longer going to be coming through the front door of those hospitals, and then they're going to have to shut down. They've already said that there are going to be at least 300 to 700 hospitals across the country they're going to shut down. And most of them, folks, are in red states. So you are doing this to yourself, Mike Johnson. Let's see. Depriving all residents of accessible health care. The blowback over Medicaid represents the most significant crackdown between GOP leaders in Washington and in the state so far in this administration, according to interviews with nearly 24 Louisiana state leaders. Yes, we need to dial it in, but we can do that and do it responsibly without endangering people's lives. Like you give a shit. Or access to quality access. See what I say? Access. There's the word right there. They have access to it. I mean, can they get it? Probably not. They're poor and we're taking away their Medicaid, but they have access to it. It's right there on the other side of the glass. There's some food right there. You have access to it, but if you don't have any money, you can't go inside and get them to give you some food. That was State Rep Jack McFarland, a Republican who represents a North Louisiana district. I live an hour from the closest hospital and I'm in a rural community. You close my rural hospital, people are going to die because they will not make it. Yeah, man, but do you think that the GOP actually gives a shit about that? You're just another statistic to them. In a former appeal to Washington, the state legislature, controlled by a GOP supermajority, unanimously passed a resolution this month calling for no cuts to Medicaid. Yeah, well, I don't think that's going to help you, man. More than 1.6 million Louisianans, roughly 35% of the state's population, count on it for health care. Under the House budget bill, which would impose first ever federal work requirements on Medicaid recipients, up to 158,000 Louisianans are predicted to lose coverage. The state's version of the bill threatens even more low-income residents. That's why community leaders, healthcare providers, Democrats, and even some Republicans warned that the deep red state has the most to lose under Trump's big, beautiful bill that Republicans are so desperately trying to get across the finish line in the coming days. Louisiana is uniquely vulnerable, says Jan Moeller, executive director of Invest in Louisiana, a nonpartisan think tank. Every state would feel the effect of the reconciliation bill, but Louisiana would feel them much more than most. And these are the kind of people that are on long-term health care, man. This is poor grandma right here, man. You're just taking it away from her. Spokesperson for Johnson said the House bill only pertains to cutting waste, fraud, and abuse. Waste, fraud, and abuse from Medicaid, not benefits. I mean, it's fucking word salad, man. You are literally cutting poor people's health care. And you're calling them waste, fraud, and abuse. Spokesperson also pointed out to expiring tax cuts. If the bill doesn't pass, that would result in $1,250 in higher taxes annually for the average family living in Johnson's district. Okay, I'd really like to see a citation on that, but okay. It's much. Hey, if the tax cuts go away, and he's talking about the tax cuts that Donald Trump passed in 2017. So he's not just talking about keeping those in place. He's talking about adding an extra tax cut on top of that. So I think he's factoring in the $1,250 for the average family living in Johnson's district as the combination of the previous tax cuts and the new tax cuts that they want. Because Donald Trump cut like $2 trillion in 2017. They want to cut $4.5 trillion this time around. So a lot of that has got to do with this one. It's much harder when you take something away. Yeah, man. Because if it's a universal thing that everybody gets, it's much harder because everybody's going to be like, hey, man, why are you taking away my shit? Louisiana was the first state in the Deep South to expand Medicaid through the Affordable Care Act nearly a decade ago. It's widely considered a success. The expansion reduced the uninsured population by half and helped prevent the closure of rural hospitals that depend on the Medicaid programs. By the way, that expansion of Medicaid was that Barack Obama offered it to the red states, and a lot of red states just refused it. They just said, fuck you, keep your money. It was 90% federal dollars and 10% provided by the state. So it was a pretty good deal for most red states. And many of them took that, including Louisiana. It's much harder when you take something away that people have gotten accustomed to, said Alice Rainier, Chief Executive Officer to Crescent Care, a federally qualified healthcare center with 4 locations in South Louisiana. People have been able to get their medications, get those cancer screenings, get their hypertension or their diabetes under control. All of those things that really increase people's quality of life and reduce costs. Yeah, man. Anyway. Hold on for a second here. Let me just get back over here. Look, folks, these are bad people, man. And I don't care how they couch it, if they say it is a reform or we're getting rid of waste, fraud, and abuse, or, we're saving it for the people who actually need it. Honey, you are cutting it from people who actually need it. Rich billionaire types don't need more tax cuts. They have more money than fucking God. But you would rather cut people's health care than to deprive those poor, wealthy people of having more fuck you money. God damn, man. What kind of country do you want to live in? Do you want to live in a country that provides help to the people that need it? I mean, the government's all about, we're protecting you from all of the outside forces. And we have the hugest fucking military that the world has ever seen. $1.1 trillion budget for this year. We've spent trillions and trillions and trillions on the Pentagon. They've done audit after audit, and they've failed every audit. They can't account for over 60% of the money that they've gotten. That's over half of the money that they've gotten they can't fucking account for because it's a goddamn slush fund. But meanwhile, if you need protection in the country from poverty, from hunger, from being homeless or living in your car, they got nothing for you, man. They're here to serve their fucking donors and make sure that they get their tax cuts. And Mike Johnson, this hair helmet son of a bitch, wearing a big fat American flag, does not give a good goddamn about American people. He cares about one group of people, and that is the wealthy. And that is who he is serving. Hey guys, thanks so much for watching. If you enjoyed what you saw, please like and subscribe. Keep rocking.